So welcome back to OET for you. So today we are going to discuss about a case note that is already provided in our blog oet4u blogspot.com. Okay, so its patient's name is Mrs. Adriana Hakim, and we have a WhatsApp group for free letter correction. So that you can see in here the letter. So we're going to correct this letter for the same case note today, and so we will discuss about the case note and come back to the letter in a minute. Okay, so the first and important thing is, so a writing subtest have 45 minutes and the first 5 minutes is for reading time. So you utilize that 5 minutes to understand your case notes, especially what is the writing task and what is in your case note. So I will tell you why it is very, very important. Okay. So here the writing task is written at the end of the case note. That is, using the information given in the case notes, write a letter to Miss Seema Iqbal, Senior Wound Specialist and Bedsore Champion, Methodist Hospital, Chicago. That is, the recipient's address is clearly given, and exactly what we have to do is mentioned in the writing task, informing her about the patient's condition and requesting her to visit the patient as soon as possible. So, also detail out the plan of care required to manage patient's pressure ulcers. So, we got a clue about the patient. That patient got pressure ulcer. Okay, so detail out the plan of care required to manage patient's pressure ulcer. So when you read immediately about the writing task, you can see the plan for the care that was mentioned about in the writing task. We need to detail that plan into your letter. Okay, so what's the plan? So refer to bed soreness, avoid diaper use, perform back care 2 hourly. So keep the patient in lateral position, keep the affected region clean and dry, use air mattress, avoid massaging bony prominences. These are the important care that required to do to manage this patient's pressure ulcer. Okay, so going back to the first of the case letter. Okay, so here today's date is 27th January 2022, and patient details is Mrs. Adriana Hakim, and age is 73 years, date of admission 25th January 2022, marital status is widow, diagnosis chronic renal failure and acute respiratory distress syndrome. Okay, social history is given, past medical history is given, past surgical history is given. Okay, so then move on to family history, regular medications, what all the medications she is on, and current medications, and recent nursing notes. What happened to this patient is given in three different dates: 21st January and 25th January and 26th January. Okay, so then what is, and 27th January, four different dates are given. So we are not going to explain it how we are going to write a letter now. So we will see the letter who is already written in our, we got that letter in our group, WhatsApp group. Okay, so the address part, 27 January 2022, that is the date of the letter. Okay, that's absolutely fine. Ms. Seema Iqbal and senior wound specialist and bedsore champion, Methodist Hospital, Chicago. That's also clear. So dear Ms. Iqbal, okay, so regarding it's Mrs. Adriana Hakim, aged 73, that's also fine. You can write either way. Okay, so when it comes to letter, so this is very, very important. When it comes to letter, there are some evaluation criteria in OET. So it is, you can easily Google search it and find and keep a printed copy in your room or paste it in your hand and read it every time. So this will be helpful for you to understand what OET is expecting from your letter. Okay, so there are 6 criteria. Okay, so in that 6 criteria there are different marking. So okay, so purpose, there is first category is purpose. In that one, you have to get 3 out of 3, then you will get a band B and above. Okay, so if you want to get a B band and above, so this you have to get a 3 in your purpose criteria. So what is that? The purpose criteria itself says the purpose of document is immediately apparent and sufficiently expanded as required. So two important things. It should be immediately apparent and sufficiently expanded as required. Okay, so we'll check that in a minute in our letter. So what's the purpose of this letter? What's the purpose of this letter? The purpose of this letter is to informing about our patient to this Miss Sima Iqbal regarding her immediate treatment for pressure ulcers. Okay, so we will check what's happened in our introduction. So I'm writing to refer Miss Adriana Hakim. Okay, that's fine. You can write refer, it's a kind of referring letter to another person, absolutely good. Okay, who requires urgent, yes it is urgent. Why it is urgent? Because we need to, the Miss Seema Iqbal has urgently come and see the patient. So where is a question mark, so it's not a home visit. Okay, and ongoing assistance regarding her multiple progressive pressure sore. So regarding her multiple progressive pressure sore is a correct one, but it's not ongoing. It's not mentioned in the case note. Okay, you can't write if it is not mentioned in the case note. So what we will read the case note and come back to it. Then we will discuss about the purpose of the letter clearly. Okay, so again, read it carefully. So, social history is African American, retired chef, husband died 15 years ago, lives alone in a rented home, one daughter, Maureen, married and lives in Spain. Past medical history: diabetes mellitus, type 2, 20 years since, yeah. Hypertension, 15 years. Obesity, sedentary lifestyles, and BMI is higher than 30 kilogram per meter square. Okay, rheumatoid arthritis, 5 years, and CR of chronic renal failure, 1 year, dialysis twice a week. The patient is already on dialysis. Okay, past surgical history. So, cataract surgery was done in 2012, and right big toe amputation was done in 2018. Okay, so family history of diabetics mellitus, hypertension, rheumatoid arthritis. Okay, and current regular medications is methotrexate 2.5 milligram daily, Humulin R sliding scale, that is, yeah, because she is DM. Okay, Atalol 25 milligram at night time, atorvastatin 10 milligram at night time. Current medications, that is current medications that you are giving now in the hospital. Okay, so we got already the admission date on from the first part of the letter itself. Date of admission was 25th January 2022. Okay, so what's happened in 21st January 2022? Recent nursing notes: patient went to arrive at the community health clinic. Okay, so difficulty of breathing and mild lower back pain. So weight, it's as already told, BMI is high, so 90 kilogram, height 157, blood pressure is high, and heart rate is, it's bit normal, not oxygen saturation in 95% on air, and HP is 10 gram per DL. Prescribed Fevol, vitamin tablets OD, and calcite 600 milligram OD tablets. Okay, so again, 25th January, the patient came to the hospital in the emergency care accompanied with neighbor, severe shortness of breath, back pain, facial and limb swelling, coma. Okay, GCS was 13 out of 15 and CBR, and intubated and kept on a mechanical ventilator, shifted to ICU. So 25th the patient was admitted and shifted to ICU itself on that day. Okay, 26th January, patient develops loose watery diarrhea, diaper in place, first degree bed sore observed, skin peel off, sacral area, comfeel applied, skin turgor loose. So positioning every shift, back care every shift. Okay. 27th, sacral bed sore progresses to second degree, and one more first degree bed sore on the right buttock region. So no positioning done for the last 15 hours. Loose watery diarrhea continues. Last back care done 8 hours ago. Okay, so the plan was refer to bed soreness, avoid diaper use, remove wet unclean sheets immediately, perform back care 2 hours early, and keep the patient in lateral position, keep the affected region clean and dry, use air mattress, avoid massaging bony prominences. Okay, where it is mentioned it is a home care. Did it mention anywhere it is home care? No, it's not. The patient is still in ICU, and the writing task is patient need an assistance of senior wound specialist, and we are requesting that from the hospital ICU. Patient is still in ICU, okay, and need an immediate referral for treating her bed sore. That is the primary purpose of this letter. Okay, so when it comes back to introduction of our letter, see, it's not a home visit and need immediate care. You can say ongoing care or immediate assistance, whatever, but ongoing assistance is not the same, because we don't need continuous assistance, we need immediate assistance or immediate care to treat that wound. Patient is in ICU. Okay, regarding her multiple progressive pressure sore, she has been diagnosed with chronic renal failure and acute respiratory distress syndrome. That was absolutely fine. So what's it says in our purpose is, see, purpose of the document is immediately apparent and sufficiently expanded as required. So the sufficiently expanded, so we said the purpose of the document is clearly that, so patient requires an immediate assessment from the service of a pressure sore nurse, that needs to be done as soon as possible. So that is the purpose of the letter, and here it is, it should be sufficiently expanded. Why it is mentioned it is sufficiently expanded? Okay, so when you want to sufficiently expand it, okay, so sufficiently expanded means you need to expand your purpose in the following portion of your letter. So we'll see the following portion of the letter. Okay, following paragraph of the letter. So it should be an immediate care, and it should be followed what is happened to the patients directly, because it's an immediate one, it's a emergency case, so you need to explain it on the second paragraph itself. Okay, so on 25th January 2022, Miss Hakim presented to emergency care following severe shortness of breath, back pain, facial and limb swelling, and coma. Okay, on examination, her Glasgow coma score was 1315. Therefore, she was intubated and kept on a mechanical ventilator, following by her shift to intensive care unit. Okay, so that's not no, it's okay. It's fine. Not to. It is explaining what happened to the patient. Okay, so the third paragraph when it comes to so yesterday. So that is 26th. Okay, 26th. Mrs. Hakim had loose watery diarrhea for which she was on diaper. So a first degree bed sore was noted on her sacral region and was treated with Comfeel. On every shift, positioning and back care were performed for her, but skin turgor appeared loose. Okay, so is that clear in that sense? So, what's another idea is you have to read your letter as the recipient. So, you are now, while you are reading your letter, after completing your letter, so you will get 5 or 10 minutes to read your letter. So that time you should be the receiver. So if you are the receiver, if you can understand the letter very well, so you will get exactly what you needed, um, more than B grade in your writing exam. Okay, so here yesterday, so better it may confusing to the reader that yesterday, so because of the date and all, it is better to write the date itself. I'm just considering it is better to write it, you know, on date itself, like in on 26th January 2022, or on the following day you can write like that. Okay, Miss Hakim had loose watery diarrhea. Let's see what's in the case note and we'll come back to that. Okay, what's happened on 26th January. Patient developed loose watery diarrhea, diaper in place, first degree bed sore observed, and Comfeel applied, skin turgor loose, positioning every shift was done, back care every shift. So you can see what was the cause and what we have done in that 26th. Okay, so you can write on 26th, on the following day, Mrs. Okay, Mrs. What's her name? Hakim, okay, Mrs. Hakim developed, okay, loose watery diarrhea, and we had put a diaper on her, or we had applied a diaper to control the diarrhea, to treat the diarrhea, or you can say um, just to make it feel good for her. That's important. So patient developed loose watery diarrhea on 26th January 2022, and the second thing is important thing is noted or monitor, or is you found one first degree bed sore on the sacral area. So, and again notice that skin turgor was loose. So what you have done, it was treated with a Comfeel dressing. Okay, it's not, it should be mentioned it is a dressing, Comfeel dressing, and positioning every shift was done, and back care along with back care. Okay, so that the three things that you can club and write. So your information given in the paragraph 3 is also fine, not bad. Okay, so it's good, but the important thing is it should be in a noted way, and it is better to write on the following day would be a good idea rather than writing yesterday. So, on the following day, Mrs. Hakim had loose watery diarrhea for which she was on diaper, absolutely fine. A first degree bed sore was noted on her sacral region and was treated with Comfeel dressing. Okay, so on every shift, So then again, because of that, you can put y here. Because of that, that is therefore, okay, therefore, shift positioning, and back care were performed on every shift, on every shift, every shift, every shift, full stop. Okay, so this is not needed. Okay, and besides, you can write besides. Okay, besides, sorry, okay, besides, her skin turgor appeared loose. Okay, this would be a better one rather than it should be a compact one, isn't it? So go for it. Yeah, so this is good. Then go for the other one, the fourth paragraph. Today on examination, the various pressure sore of the previous pressure sore of Mrs. Hakim progressed to second degree. Additionally, additionally she has another bed sore. She has another bed sore. Okay, so additionally developed another bed sore on the right buttock region. Developed. Okay, additionally developed another bed sore on the on her right buttock region. Okay, on her right buttocks region. She also has persistent diarrhea. Okay, that's the spell check is stent. Okay, persistent diarrhea, that's fine. So no positioning and back care were performed for the last 15 hours and 8 hours respectively. That's fine. So that's absolutely fine. The fourth paragraph is also good. So then again, what is the nursing care we have to provide to Mrs. Hakim is another important thing. Okay, so when it comes to the plan, so you should write in a so nice manner. So it would be appreciated or highly appreciated. Okay, if you could perform back care every 2 hours for Miss Hakim, is that correct? Because we are writing to, you know, the nurse in charge, not the Sabina. What's the recipient's name? Okay, one second. Seema. Okay, so Seema, we are writing to Seema, nurse Seema, because is not to provide back care. So she need urgent treatment. Write it again in a different paraphrased sentence. Then you write, these are the suggestive care you are suggesting to the nurse who is coming. Okay. So it would be highly appreciated if you could immediately assess the condition of Mrs. Hakim. Okay. So I'll write it down. This is the skin condition of Miss. Sorry, that's my mistake again. Okay, so condition of Miss Hakim Hakim. Okay. And what you are suggesting is that is you already written there in your letter. Okay. So that's it. Oh, good. So, if appreciated if you could perform back here every 2 hours for Mrs. Hakim. So, kindly keep her in lateral position. So, kindly provide back care every 2 hours and keep her in lateral position. Okay. Clip the area clean and dry. Okay. And it is important to avoid diaper and to massage bony prominent. Okay, so here two spelling mistakes here. It's not message, it is massage. Avoid massaging bony prominences, and not provinces is prominences. Okay, that's it. Okay, please consider using an air mattress. Okay, so the letter was overall is good, but because of the purpose of the letter is deviated from the actual one, the evaluator is going to give a C or C plus. Maximum is C plus, not more than like C 3 to 90 300 marks is the score is the best for this letter. So you can write it in a good way, and if you want you can just rewrite the letter and send back to us. Thank you for sending your letter to our group. Thank you.